Good afternoon. We're back for our next departmental budget discussion. I'm Mayor David Briley. I'm joined by Emily Pacini to my right, who is the Chief of Staff here in the Mayor's office, and Talia Lomax O'Neill, who is the city's Finance Director. Before we jump into to next year's budget, just want to circle back and talk a little bit about last year's budget and say that about this time last year, we saw revenues were not going to be sufficient to do what we wanted to last year, so we came together as a city, tightened our belt, lived within our means for a year, and have had some additional revenue growth in the next 12 months. So this year we'll be in a position to do a cost of living adjustment steps and open range increases for our employees, and I hope they see that as an acknowledgement of how important they are to the city and our pride in the work that they've done over the last year. Our next budget discussion is with the Metro Public Health Department. We're joined by Dr. Wendy Long, who is here for her first budget hearing with the City of Nashville, being probably our newest department head. I'm thinking that's right. Since, is this still March? This is your first month, isn't it? This is your first month here. Even though you're new, I just want to thank your department for all of the work and collaboration that's taken place with the community over the last year to focus in particular on behavioral health and on the effort to end the HIV/AIDS epidemic, where we've seen great progress as a community just in the last year. With that, Dr. Long, I'll turn it over to you if you'll introduce yourself and the colleagues who came with you, and then maybe save a little bit of time for questions at the end.
Sure. Good afternoon, Mayor Briley, Chief of Staff Pacini, and Director Lomax O'Neill. We appreciate the opportunity to be here today to present our proposed fiscal year 20 budget for the Metro Public Health Department. I am Wendy Long, the new director, and with me today is Dr. Sammy Ariola, our Deputy Director, and Diane Harden, our Finance Officer. And we have several other members of the Health Department team in attendance today, including representatives from the two areas where we've submitted a proposed improvement request. So if we need their expertise, we can call on it. But before discussing our improvement requests, I wanted to highlight some of our accomplishments over the last year. And I want to make a special note that it is the very passionate and talented team of over 500 staff that are the ones that actually deliver the services that I'm about to describe and that are responsible for the successes that we've enjoyed in the last year. As you know well, our mission in public health is to protect and improve the health of Nashville citizens and residents. And we protect the population through three primary types of activities. The first are efforts to prevent the spread of infectious diseases. And so this would include things like investigating disease outbreaks or our initiatives to try and improve immunization rates in the county. We also are involved in more regulatory sorts of activities like inspecting restaurants and hotels and swimming pools and body-piercing establishments and all sorts of different arenas, as well as involved in air pollution control activities. So basically, these are activities that are intended to protect Nashville residents from environmental health threats. And then third, we protect the health through the work of Metro Animal Care and Control. They're involved in both protecting our human citizens as well as the animals that reside here with us. I wanted to focus on just a couple of, I think, successes in this arena of protecting health. And the first would be our response to the hepatitis A epidemic. As you know, hepatitis A is a vaccine-preventable disease that can cause serious illness. It can affect anyone, but those at greatest risk are individuals who are experiencing homelessness, individuals who use drugs, and men who have sex with men. Since we recognized and announced the presence of the epidemic in late May of last year, we and our community partners have really done targeted outreach to these high-risk populations. And as a result, we have provided free vaccine to over almost 11,700 individuals. And the really good news is that we're beginning to see positive results from that effort and that we're seeing a clear downward trend in terms of the new cases that are reported to us each week. We also have much to celebrate in the area of Metro Animal Care and Control. This past year, Metro had a 90% save rate for dogs and cats, which is just an unbelievable improvement from where we were just a few short years ago. I cannot say enough positive things about the staff. Lauren is here today, about the volunteers, about the organizations that support the work of MAC. It is through their dedication and hard work that we've achieved this. Our ability to sustain this does come at a price, and so in a few minutes I will talk about one of our 2 improvement requests that's related to MAC. So I've talked a bit about our role in protecting health. The other significant part of our mission is improving health. And we do this through 2 types of strategies. The first is our services that are delivered directly to individuals and families by the local health department. And then the second is through community partnerships to address population health issues that are bigger than what any one agency by itself could achieve. When it comes to our direct interaction with individuals and families, the health department operates a number of programs that are designed to help to facilitate access to care and to coordinate needed social and health services on behalf of individuals. Usually these programs target a particular population group, like pregnant women or children or individuals living with HIV, and you'd be familiar with some of these programs under names like HUGS or Project Access or the Ryan White program. The department also delivers a variety of preventive health services in 4 different clinic locations across the county. We provide dental care, immunizations, family planning services. We treat certain types of infectious diseases, including tuberculosis. And we provide services in schools through our dental sealant program and through the school nursing program. Last year alone, health department dental staff saw over 6,000 students in 46 schools and provided 17,000 dental sealants. And school nurses saw 5,000 children a month in office visits and provided a wide variety of procedures ranging from medication administration to tracheostomy care. Complementing these direct services that we provide are the services that we deliver through partnerships with other entities. And these partnerships are so critical to addressing complex public health issues like the opioid epidemic or like the disparities that we see in health indicators across population groups. And we want to thank you, Mayor, for the priority that you've placed on these kinds of collaborations and partnerships, and especially for the role that you played in bringing together the experts around the HIV epidemic in order to really try to stop that epidemic in its tracks, as well as bringing together experts in the mental health arena to address issues and concerns related to behavioral health. As you know, these sorts of collaborative efforts resulted in the recent opening of the state-of-the-art treatment center at the co-op that is already really reducing demands on emergency rooms and providing an avenue for police officers to find treatment for individuals in their care rather than taking them to jail. So I think this is just an incredible example of what can happen as a result of collaboration. Turning now to next year's budget and our 2 improvement requests. The first request relates to an expansion of our school nurse program. The complexity of nursing care provided to public school students by school nurses has increased dramatically as the range of medical accommodations has expanded over the years. Students who once were considered to have medical needs just too complex for them to attend a traditional school classroom now routinely attend the classroom that they're zoned to. And we have school nurses performing skilled medical procedures required by these students, as well as school nurses involved in activities that contribute to improved attendance and better student well-being among the population of students as a whole. There's also additional research that demonstrates that school nurses support educators and allow them to be more productive in the classroom. Our improvement request is for the addition of 14 new school health staff. This represents the second phase of what was originally proposed as a three-phased school nurse expansion. The first phase was funded 2 years ago, and it resulted in our ability to place one school nurse in each traditional high school. This improvement request will get us halfway towards our goal of having one school nurse for every 2 of the remaining schools in the school district. And then our second and final improvement request would fund 6 additional positions at MAC. As I previously mentioned, MAC has achieved incredible success, but that success has been achieved with officers routinely being called upon to work 12 to 16-hour shifts. And with staffing levels that are well below nationally recommended standards. In addition, a recent change to Metro Code that placed restrictions on when animals can remain outdoors in inclement weather has led to a doubling in the number of calls that MAC receives at a time when calls were already increasing simply due to population growth. So MAC is a 365-day-a-year operation, and these additional staff are needed to support their ability to continue to function at their current level of performance. And that concludes our prepared remarks. We'd be happy to try and answer any questions.
Can we talk about MAC just for a moment? I know for at least the last 2 budget cycles, we have provided some improvements in that programming. Can you speak to what those investments have done already to contribute to services? Is that what's helped us get to the 90% save rate?
And I'll try to
people need to understand what those prior investments, how those prior investments have paid off.
And I will talk to that at a high level, and if anybody else wants to. I think the fiscal year 18 improvement was related to a computer enhancement that allows us to read chips in animals so that when a dog is picked up, we can identify if there's a chip, and that would allow us to place the dog back with the owner. And so certainly that, I think, has contributed some to our success because we're all about adoption or getting animals back to their homes. The second improvement in fiscal year 19 was related to the SAFE Coalition, which is an entity that's allowing us to vet the many partners that we have at MAC that, again, contribute in an incredibly positive way to our ability to assure that we have reached this 90% adoption.
I just know that this has been a priority.
Absolutely.
And
absolutely,
people are actually paying very close attention to the needs.
I think we have a program that we can be really proud of at this point as a city.
Yeah. And then I think it might be worth noting, probably for the audience, that I don't think people realize that about half of your funding for running your department is coming from grants and not coming from Metro resources. So it might be just worth a moment just to explain that to the audience that.
Yeah, out of a roughly $48 million budget, a little over half, $25 million, come from grants, and it's one of the things that makes working at the health department interesting because we have so many, in some cases, small funding sources that fund such a wide variety of programs. But we do try to make sure that everything that we're engaged with, ultimately contributes to our mission to protect and improve the health of the population.
Okay.
You're a new director, and just curious what some of your immediate kind of short-term goals are for the department.
Yeah, short term, I'm doing a lot of learning about these many and varied programs. I think one thing that's very important to me is assuring that our staff really have, understand our mission and understand how they contribute to fulfilling our goals in the department. So that'll be a high priority. I'm also looking a lot at our clinic operations and how we can be more effective there and operate more efficiently. One of the things that we'll be looking at is our needs for an electronic medical record and whether or not we want to participate in a record that the state is rolling out or whether or not we want to pursue something that is more specific to our needs.
My turn?
Yes, sir.
I just had two things. One is, so I've been going to MAC since it was out on County Hospital Road, so there are probably not many people in the room who remember when it was there. And I'm sort of a surprise visitor even occasionally now just to see, frankly, because my wife likes to go look at puppies on the weekends, so we're not adopting any more dogs. And I can just attest to the fact that the trajectory there is great. I mean, it's just a much better place than it ever has been before, and any support we can give is going to be something we try and do. One, since your background is probably unique for the public health director here in Nashville, and I know you were sitting here as we heard about homelessness just a few minutes ago. One of the things I think we ought to consider, and maybe this is not a budget discussion, but I'm going to have it anyway,
Sure.
is I know Chicago just expanded a study they were doing there where they were providing housing as to the most frequent users of their emergency room, their safety net emergency room. And they found that the cost was a little bit lower actually per person when you added the housing and the continued health services for that individual. And they did it for 25 highest users and then have expanded it beyond that. So as we open the homeless service center with the housing, permanent supportive housing, it seems like it'll give us a moment where we can maybe experiment with that, and in collaboration between General Hospital and the social services and the health department to sort of see how we could use our resources, the equivalent or less resources, to get a better result for folks who live in our city. So since you have a unique background in terms of looking at the utilization of healthcare dollars, I think that's something I'll ask you to help us work through in the coming year.
Absolutely, I'd very much like to be a part of that, and we do have some money targeted now to homelessness, and
so it seems like it might be some way for us to make progress for everybody on that one.
Absolutely.
Great. But welcome to
Thank
Metro, and look forward to a good year together. Thank you.
Thank you.